Welcome everyone to the EHC special celebration of World Hemophilia Day. My name is Olivia Romero-Lux and I'm a member of the steering committee of the EHC. Due to the COVID-19 crisis, we've had to cancel our meeting in Brussels, which was supposed to take place Friday, 24th. So the steering committee of the EHC decided to host instead a whole week of events over the internet. We had to reinvent ourselves in order to reach out to you and make of the general theme of the World Federation of Hemophilia, Get More Involved, a reality. Which brings me to the task I've been assigned by my colleagues. Yes, I've been asked to talk about patient engagement and what it means for the EHC and for our community. Before talking about patients' engagement today and tomorrow, I would like first to set the scene and give some background on what we've achieved and what we can be proud of. When you meet other patients' communities, you quickly realize that sometimes it feels like we are ahead of them, not all of them, but in the rare disease community, we can tell that patient engagement in hemophilia is often considered to be a role model. So why is that? First of all, I would say that patient engagement is tightly linked to the patient and healthcare professional relationship and to the level of knowledge patients have. Until the blood contamination, the patient healthcare professional relationship was more of a top to bottom relation. And it was very hierarchical, and patients listened, well, let's say most of them listened, and were reactive rather than proactive in choosing and implementing the treatment. They were pretty much following the doctor's recommendations. Then we had to face a massive health crisis, a cultural tsunami for most of us with the blood contamination, where we had to take our fate to our own hands, understand the condition, the treatment, and the best options, taking into account safety, efficacy, and availability of what was on the market. Patients became very proactive, experts of their own condition. Today, our community has never been so strong. I hope you agree with me on that. We are knowledgeable, we are skilled, we try to be in control, we are determined, engaged. Our members are realistic, and yet they dream and ask for more. More resources, more access to treatment, more resources for comprehensive care, more support, psychological, social, more research for other bleeding disorders. So what is patient engagement today? And to answer this question, I think we need to go back to what brings us together at the EHC, to the objectives of the organization. First, our goal is to improve the quality of life of people living with rare bleeding disorders through diagnosis, adequate supply, and access to safe therapists and comprehensive care for all. Second, we need to advocate and promote patients' rights, as well as influence European regulations by collecting data and promoting research. Then, and I think this is crucial for getting people more involved and patient engaged, we have to empower national members organizations, our NMOs, collectively, but also patients individually, to promote patient commitment and willingness to advocate in the better interest of all. Thanks to a very dedicated staff and a brilliant team of volunteers, the EHC supports and offers services to approximately 90,000 diagnosed patients living with a rare bleeding disorder, but also can help get the undiagnosed diagnosed in collaboration with the WFH. The HC draws on the individual knowledge and expertise of each and every member of the patient community, but also of the healthcare professionals, especially thanks to the EHC's medical advisory group and the EHC's medical and scientific advisory group. The EHC is convinced that next generations will take over and engage only if they know what they really need to fight for and how to advocate. We offer opportunities to promote youth and to open our actions not only to people with hemophilia, but also to those affected by other diseases like von Willebrand, Glanzmann, Bernard-Soulier. Our events target and include everyone. So then, should the patient engagement be tomorrow? How does the HC make sure to get everyone more involved? Well, just like the COVID-19 forces us to reinvent our ways of actions, our ways to reach out to all of you and fulfill the EHC's missions and objectives. How do we engage patients? How do we get them more involved in unique circumstances? Because what we are about to experience in the next years in the rare bleeding disorders field is quite unique. Because of COVID-19, our events have nowadays to evolve at European level. Same for the ones organized at national and local levels. Our World Hemophilia Day has become a World Hemophilia Week. We don't meet. It is definitely a first for us and for everyone. And we hope that on April 17th, you found new ways to celebrate this day in an inclusive manner. Our next events, namely the Women and Bleeding Disorders Conference in May and the Leadership Conference in June, will be virtual with new formats. So stay tuned for more information in the weeks to come. But beyond this COVID-19 crisis, and with new therapies on the way, which supposedly would prevent almost any bleed, how do we collectively promote patient engagement? And for the future, why engage when you don't need? And what would be the future of NMOs then? No members, no NMO. I would say that everything comes down to good governance, handling, managing with ethics, transparency, and good common sense will help you build trust, legitimacy, and secure funding also. Funding is a key thing, but with an industry landscape that is rapidly evolving, you need to make sure you diversify your funding sources. You advocate for support from your government, private or public foundations. You stay aware that, like the COVID-19 has disrupted our lives, funding can be challenging too. Including women, youth, people with other rare bleeding disorders in your boards ensures that everyone feels a sense of community and wants to engage and advocate for the better interest of that community. Training your members is crucial, as knowledge is power. New therapies are sometimes difficult to understand. Their mechanism of actions, the pros and the cons, safety and efficacy issues still need to be assessed. Patients and the families have sometimes to make difficult choices. And sometimes they don't have a choice, as those therapies are not available in their countries. So raising awareness among regulators, politicians, health authorities is also important. The EHC can help you with all that. This is a circle where all stakeholders and all aspects are intertwined. To engage and keep volunteers, to have committed patients, you need to work on every aspect of the environment. You need to reach out and try to accompany the best way possible. I hope this very first session of our World Hemophilia Week has given you food for thought. As you may have noticed, I don't have all the answers to the questions you may have, but this video is an opportunity to reflect on what you have achieved over several decades and how we need, COVID or not, to reinvent our engagement individually and collectively to make our community even stronger and more inclusive in order to ensure the best care and treatment for all. So let's get more involved, stay safe. Thank you.